Hi, everybody. Ian Bremmer here with your world in more than 60 seconds. Again, as long as we've got coronavirus, we've got too much to talk about. Got your questions here, though, and we're ready to go. Number one, what is going on in Brazil? Is it at a tipping point? I'm not sure it's a tipping point for Brazil, but it's a tipping point for Bolsonaro. I mean, you know, this president, when he came in, it was after years of political scandal, Lava Jato. You even had impeachments, right? You had all sorts of ministers that end up getting thrown out of office. You had former President Lula in jail. You had Dilma Rousseff impeached. Finally, we got somebody clean who has the former federal justice who helped put away a lot of these ministers as the new minister of justice. Well, I mean, now not only do you have a president that has mishandled coronavirus and attacked the governors as fake news, and you can't have any shutdowns, and the numbers of cases in Brazil are spiraling much higher per capita than in other major Latin American economies, but now he's gotten rid of his minister of justice. The guy left. He's resigned because he said that Bolsonaro is interfering with investigations, getting too close to his family. That really is exactly the opposite of what you want to achieve in the midst of the worst economic contraction, maybe in Brazil's democratic history. His approval ratings are dropping. He's down in the low 30s now. He might end up getting impeached. He'd have to lose more support for that to happen. But certainly the idea that he's going to govern effectively in Congress with the reformist coalition, that is all off the table right now, and he is in a lot of trouble. So this is definitely the beginning of what I suspect will eventually be the end of Bolsonaro. It's much harder to imagine him certainly getting another term given what he's doing right now, but even maybe lasting the full term. We'll see where we get. Why is speculation surrounding Kim Jong Un difficult to confirm or debunk? Well, because he's not saying anything, and it's the world's most closed totalitarian dictatorship. We haven't heard from Kim or anyone representing Kim saying how Kim is doing for a couple weeks now. Now, yesterday, President Trump came out and said, we're going to hear from him pretty soon, which is the closest we've had to intelligence, believe it or not. I mean, certainly it sounds like Trump has heard through U.S. intelligence that Kim Jong Un is still alive. Probably via the Chinese, I expect, not from the North Koreans directly. But we still haven't heard from him, and that does imply, especially given all the rumors and given a big national holiday just a few days ago, that he's not well. He's not able to appear publicly in a way that would be appropriate for mass consumption. Does that mean he's a vegetable? No, but it does mean he's hurting. It does mean there's a real problem. And if he does die, if there needs to be a transition, it's obviously dangerous. The potential that the Chinese might have to step in is real. They would do that if it looked like there was instability that could shake the regime or could lead to dispute over control of, let's say, the nuclear weapons and even the conventional forces in North Korea. So until we find out that Kim Jong Un is okay, there's going to be a lot of concern. Finally, has Africa been spared by coronavirus? Well, I mean, the numbers of cases in Africa are very, very low, but the main reason for that is because they're not testing at all. Also helps that there isn't as much travel to and from Africa, which is part of the reason why it's economically underdeveloped, but also prevents the cases to get into African countries the way they've transferred into Europe, into the United States. Certainly a lot of Chinese from Wuhan went to Africa, are working there. They were there in China during the New Year's celebrations and left. But that's very different from the kind of spread that you would get from the travel that you get in the U.S. or in Europe. Also, let's keep in mind that so many of the cases are asymptomatic. We're finding that in New York, in Massachusetts, in Washington State, in California. These are very young populations in Africa. The most populous country in Africa, Nigeria, it's 18 years, I think, is the average age, 17 or 18, which means the vast majority of people that get this disease won't even have symptoms, never mind getting sick. And so, I mean, if you're an African leader and you don't have ventilators, you don't have adequate healthcare personnel, you don't have test kits, and your economy's in bad shape, you're just going to keep the economies open. And so that doesn't mean that Africa is spared, because obviously you're going to have still the economic slowdown globally, and people aren't going to be traveling there. You won't get the tourism. Supply chains will get disrupted. But you're probably not going to get the kind of closures of African economies that you get in other countries, even emerging market economies. And even in places where they do, so much of the economy is informal and so not controlled by the government, so it doesn't actually shut down. So certainly you're going to see a lot of people getting sick, a lot of people dying, whether or not that's known publicly or it's considered dying from some other comorbidity is an open question. But I can say that some of the poorest countries in the world probably won't have the same kind of impact from coronavirus that the middle-income economies actually will. So if there are silver linings there, we'll take them. And I'll see you guys all very soon.